call the meeting of the Healthy Communities and Environment Committee to order at 11 a.m. Roll call, please.
Powell.
Present.
Kokendorfer.
Here.
Gershenson is absent with notice. Nelson.
Here.
Taub.
Here.
Loops.
Here. We have a quorum. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. It looks like there are no minutes to approve as the committee names have changed and we approved the minutes at our last meeting. Would that be correct?
No minutes to approve, correct.
Okay. Our next item is approval of the agenda. Are there any changes or corrections to the agenda? Seeing none, we need to a motion to approve the agenda.
Support.
Moved by Adam Kochenderfer.
Close enough.
How do you pronounce your last name?
Kokendorfer.
Kokendorfer, thank you. And seconded by Shelley Taub. All in favor signify by saying aye.
Aye.
Any opposed? The motion is carried. We'll move on to public comment. Is there anyone from the public who would like to address the committee? Yes.
Mr. Chairman, Mark Newman, Director of Public Services. We're not on your agenda today, but I wanted to take the opportunity at this first meeting to introduce a couple of the managers from two of my departments that this will be their liaison committee. First, I'd like to introduce Mr. Garth Wooten. Garth is the manager of Veteran Services. And so you'll be seeing Garth on a fairly regular basis here. Thank you, Garth. Secondly, I have Ms. Sheila Leddy. Sheila is the administrator for Michigan State Extension. You know, we're in partnership with the Michigan State University, and Sheila is the county employee that runs the office and manages it on our behalf, in concert with Ed Scott, who I thought Ed was going to be here. He's the District 11 coordinator for Michigan State Extension, but you'll be seeing that also. But this is Sheila Leddy, and these individuals will on occasion come before you. And just want to take that opportunity to introduce them. Thank you very much.
Thank you. Thank you for being here. Anyone else? Yes.
I just want to introduce Amy Aubrey, your first day on the job here at our new analyst.
Hi, Amy. Yes.
You have to know all our names by tonight.
Hi, Dan Stensel, Executive Officer for Oakland County Parks, and I've been asked by Chris Ward to make a presentation at your next meeting to kind of bring you up to speed with parks and recreation issues.
That sounds good. All right, thank you. Anyone?
Well, let me introduce Ed Scott just walked in. Ed, District 11 coordinator for Michigan State Extension. So, Ed, I already took the opportunity to introduce Sheila. Wonderful. And I just wanted to introduce this guy.
Welcome, Ed. Anyone else for public comment? Seeing none, I will close public comment. We'll move on to our regular agenda. The first item on the agenda is the Department of Health and Human Services Health Division, Nurse Education, Practice, Quality, and Retention, Registered Nurses and Primary Care Grant Acceptance.
Good morning, I'm Kathy.
One moment, sorry. Do I have a motion? Motion made by Shelley Taub and second by Kristen Nelson. Thank you.
Thank you. I'm Kathy Gorsley. I'm the Director of Health and Human Services, of which the Health Division is a part of. And I'll turn this over now to Leanne.
Good morning. I am Leanne Stafford. I'm the Health Officer for the Health Division. So for this first item on your agenda, this is the Nurse Education Practice, Quality, and Retention Primary Care Clinic. And what this grant is doing is we're working with Wayne State University College of Nursing to actually bring in 3 of their students, their BSN students, to actually work alongside and review and see what our nurses do and actually learn alongside of them of what happens in the community. Currently, we already see BSN students from Wayne State, Oakland University, but this is actually taking a step further, and we're going to actually work with a preceptor, which is a more one-on-one, really explaining what's going on in the field so that these students will really see what we do in the field and understand what public health does as nursing. So this grant is for the 1 year, which is $68,878. And it started in July of 18 and it goes through June of 2019. So it's actually going to be about 6 months where we're actually going to be doing this work.
Yes.
Leanne, I noticed that it's July of 2018. That was a while ago.
Yeah, and so basically they're going to start, once this is approved, we'll start working with these students in January.
Okay, so what happened for the 6 months before that?
I'm assuming, I'll have to get back to you, I'm not 100% sure, but I'm thinking we just haven't started the partnership yet. And so since it's a 4-year concurrent period, they'll start in January and start working with them.
Okay.
Typically, these types of agreements take a long time to work through, both our corporation council and theirs as well. So I'm not sure if that was the case here, but when we have these types of university agreements, it's kind of a lengthy process.
For $68,000.
Yeah.
Okay. I get it, but you know, maybe it's them not sending the money or whatever. But it's sad, I hate to lose 6 months of training. Will they possibly extend this for 6 months? You know, because we're losing the training time for the kids. For the nurses. Yeah. So if that's a possibility, if they haven't sent us the money already, but I'd like very much to see if we can't extend this beyond, in other words, start now and then go an extra 6 months or whatever, if that's a possibility. Would you let us know?
We'll look into it.
Yeah.
Definitely.
Okay. Thank you. Thank you, Madam Chair.
Sure. Is there any further discussion? Any other comments or questions? Hearing none, please call the roll.
Powell,
Yes.
Kokendorfer,
Yes.
Nelson,
Yes.
Taub,
Yes.
Lutz,
Yes. The next item is the Department of Health and Human Services Health Division, Huron Valley School District Interlocal Service Agreement Amendment and Acceptance. Do we have a motion? A second? Moved by Shelley Taub and seconded by Angela Powell.
Yike. Sorry. Was a Michigan fight song, I'm sorry.
This interlocal agreement allows our environmental health sanitarians that have specialized training in sampling to actually work with Huron Valley Schools, that's what I said, sorry, to go out and do some groundwater monitoring due to a contamination that was caused by the district's wastewater treatment plant. This started back in 2011, and so again, it takes very specialized training to take these samples, and so Huron Valley contracts with us to go out and do those samples for them.
Thank you, Shelley Taub.
Yes. What are your results? You've been doing this for quite some time, as I recall. Have you had any difficult results, or everything seemed to check out okay?
I think everything, well, they look for sodium, chloride, and hardness, so they have not seen any increases. It's just a long-term monitoring to ensure that those samples are not increasing in those 3 analytes.
Okay. Are they looking at all about leaching from septics, or no?
No.
You don't have that?
No, this was specifically from the wastewater treatment plant, and so this was not involved in septics. They were really just looking at sodium and chloride is where the exceedances occurred back in 2011.
Okay. So we're doing okay? They're fixing it up or cleaning it up?
Mhm.
How long do you think this will go on, forever and ever?
We thought it would be done a while back, but they keep extending it, so I think they're just looking for potential migration to the aquifer. but
Okay.
Not seeing it. I
So
don't
far,
think.
so good? Okay, perfect. Thank you, Madam Chair.
Sure. How long has this agreement been in place?
Since 2011, we have been taking samples. So we bring it each year that they renew it with us, and so we've been taking samples since 2011.
Thank you. Any other discussion on this item? Roll call, please.
Kokendorfer,
Yes.
Nelson,
Yes.
Taub,
Yes.
Powell,
Yes.
Lutz.
Yes.
Motion carried.
The motion is carried. The next item is communication from the Department of Health and Human Services Health Division, 2019 Michigan Medicaid, Michigan Medical Marijuana Operation and Oversight Grant Application. We would need to receive and file this communication.
Wait a second.
Is there a motion for that?
Wait, I can't bring it
Does
up.
somebody have the communication?
But I have a question. So when do we, okay, just let me know.
Oh,
But I'll move, right?
yeah, you can move to receive and file. I'll support you.
Okay. I move to receive and file.
Support.
Okay.
Now
Mhm.
questions. Now questions.
Yes. What,
So now I can ask my question?
yes.
Yeah.
Okay, so I've been watching this, since it was brought to our attention at the last board meeting. I happened to be here in December. And after reviewing this grant, because I don't know if some of you know, but Pontiac is looking to possibly be able to have up to 24 dispensaries and unlimited processing, grower centers and stuff like that, right? So this is something that's on my radar, cause it's about to happen in my district. So, the grant, so I have some questions. The grant explicitly states it is for education for medical marijuana. The target audience must be qualified and registered medical marijuana licensees. There are offshoots, children and teens of medical marijuana cardholders. The scope of this project is based in substance abuse and in violation of the nature of the program. This is not for all residents. This does not address in any way of the current adult use law. Now, that is something that I kind of agree with. When I read overall the application that was submitted by the county, it seems as if we are using the funds to support some of our current positions or departments that we have in place, and not stressing the importance of educating and educating like it's supposed to the community. So, and then another question I have is, what previous experience should a vendor have interacting and educating multiple demographics throughout Oakland County? How does a mission to being a registered patient affect the child welfare, custody, and visitation? Ties to the policy and government. So who is educating on the current of this law? And then my last question is, what is the connection to the communities at large that are current and future medical marijuana patients based on the qualifying conditions?
I think we might have some answers from these two
Thank you.
ladies.
Well, I hope we do. I'm not sure I completely understand the question, but the intent of the funds from this grant are to be utilized for education and outreach for medical marijuana only. And the intent of our health division is to provide messaging, public health messaging, utilizing CDC, I can't remember, Samsung, NINA, information about unintended consequences. You know, when you receive an opioid from your doctor, you pick up the package and it has all the other things you need to know to make an informed decision about whether or not this is something you should be taking or not taking. You can make your own decision, and so public health has always been a strong partner in the community in terms of making sure people understand the risks and unintended consequences of whatever it is they might be taking, whether it's legal or not legal. We get involved with both types of messaging. So that is the intent of this funding, and we intend to work alongside our other public health partners and have consistent messaging across the state regarding this. I was at a meeting in Lansing last Friday on the governor's public health policy, our advisory council, and our partners across the state are very interested in making sure that the messaging that comes out of this funding is very consistent and speaks to things like the risk that people might not think about of increased access to children, pregnant women that might have been prescribed and then become pregnant during the course of having this prescription. What are the consequences of that? There's many, many things that really aren't well understood. There's not a great deal of awareness in the community about that, and it's our intent to fill that gap.
Okay, I have another question. Sorry, that one's not working. Hold on just 1 second. So why is it that in two of the departments, no, one of the departments, well, no, two of them, why are we spending $73,000 in information technology and development and operations?
One of the things that Leah maybe can speak to this better than I can, but it's utilizing a resource to do better reporting, provide a better methodology for people to get information, and it is to purchase a new service to utilize that. Do you have that?
Yep. Yes, so we're looking at, like you said, a better reporting system that pulls data from all different organizations and allows us to tell or display the data to see what we're seeing in some of the trends. And so it's a system that we would buy from, it's a third party. We still have to go out for bid to actually find, there's a couple of manufacturers or people that build these systems that we would go out and talk about what our requirements are to build that system.
The problem is there's so many sources of information. There's a lot that's happening across this nation regarding this. Well, there's other uses for this system as well, but it's a way to pull information together and to be very transparent to the community and make it very user-friendly for anyone to pull up and take a look at information that might be relevant to them.
Now, how are you all gonna determine, is this just gonna be like a big countywide project where all residents get it, or y'all gonna determine it based upon where the medical marijuana dispensaries are being approved in the municipalities? Is that how y'all gonna channel who gets what information?
It's just
Or
gonna be out there on the website that they could just take a look at and pull down whatever information is interesting to them or relevant to them to make informed decisions.
Is there, okay, and then with the hiring process, how are y'all gonna vet those people? Are y'all gonna do more internal, folks that y'all already have trained, or y'all gonna seek out and contract that way with the folks that may have expertise in these fields?
So we're looking at health educators here, and we have a health educator unit that is very visible in the state of Michigan, and we have a lot of health educators that we have worked with over the years that might be appropriate for this position, but we will just go through a hiring process that we would normally, but we do have a lot of knowledge about health educators across the state of Michigan that we would get someone very appropriate for these positions.
But specifically with a targeting profession in marijuana?
No. A health
So a health educator can
health
just...
educator, we hire health educators to talk, be able to speak and research and analyze data regarding a variety of issues, and this would be no different Then we have health educators that are very knowledgeable about opioids, suicide, substance abuse.
Opioids and marijuana is two different.
I gotta understand that,
That's two
but
different
the
things.
health educators are very skilled at doing the research and the analysis necessary to be able to provide valid information.
So with the community partnerships, if there are more communities that is in more of a demand and need of the information, would that be taken into consideration with you all assisting that community more? The only reason why, because if we balance this out, I'm just nervous. A lot is about to happen in my city. And I just want to make
But
sure that my
about
community.
medical marijuana or recreational marijuana? Yeah, as far
Actually,
as I know, it's
well, no,
recreational.
it's all, no. We are, right now, they have a, permission to vote up to 24%, allow up to 24 medical dispensaries in my
Medical.
community. That's why I'm asking you these questions. And so, in that sense,
So this grant does include a lot of outreach dollars, and our health educators would be working, doing a great deal of effort in outreach to dispensaries or in whatever CBT they happen to be in.
okay.
Yes. Shelley Todd.
Thank you. If you look at the chart under the grant, you will see that there are approximately 2,496 patient cards out. Those that have been renewed are 17,000, and that the state is giving grants to counties based on their population. And if you notice, in Oakland County, there's $366,702 available through the state of Michigan for this process. You can see other counties above and below it. I haven't looked at Wayne County yet, but their total is $496,000. So based on their card holding population for medical marijuana, as I understand it, you will be able to receive grant funds for this educational purpose. And it has nothing this is not a, how should I put it? This is not a law enforcement thing. This is a health education issue.
I understand
Yeah,
that.
that should be taken care of. I don't think the intent is to go in and close up.
No.
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 And I think you had asked another question about children in homes where medical marijuana is used. Obviously, none of us want children to be using marijuana at little ages. I don't think that's the intent of this, to educate people that, Grandma, if you need to use this, or Grandpa, or somebody else, you need to make sure it's safe and put away. So this is the kind of stuff, people don't think of this, they just don't think of it. And of course, obviously, it would be difficult for children in homes like this.
Yes.
Thank you,
Yeah,
Madam
the
Chair.
only reason why, just so you know, Sherry, the only reason why I'm so concerned about it is because I'm about to, if there's a possibility I can have up to 24 medical dispensaries. We know the state of Pontiac. It's no secret around this table. So at the end of the day, I just want to make sure that if privy and I need to get additional information, I want to be able to share this to educate my community as much as possible.
Yeah.
Because rec is coming behind it. And I'm just hoping and praying that my city don't approve that one. But that's why I had the question. So just thank you for
Yeah.
the clarity.
Yeah,
And I just
and you
want
can
you to know
direct them
where
to the
I'm at with it.
website when we get there.
Yeah, but that's another issue, the incompetency and incompetency level in my district. So I just have to make sure, I have to do a lot of extra legwork to make sure the connection is there.
And that's something they'll be doing too, is really gearing up for presentations in communities and being able to make sure that it's understandable for the general public. And there's a lot of technical information out there, but that's not what the general public spends any kind of time reading or even tries to
No, they don't.
understand. And that's what a health educator does best.
Thank you.
Commissioner Todd.
Do we still have that program with the health educators in Pontiac that's available through the schools? Do we have a health educator or school nurse?
With school nurses.
Okay, and that will be disseminated to them as well?
Oh, absolutely.
Okay.
Yeah, so
Great,
that would
thank
help you.
Thank you.
Yeah. Okay. Thank you, Madam Chair.
Thank you.
Thank you.
Yes, Commissioner Nelson.
I appreciate the comprehensive approach to implement the project activities. Can you give a couple examples of what kinds of activities for the education activities awareness campaign and outreach activities, just to kind of get an idea of what that looks like.
So when we say activities, we're talking about all the various tools they have available to them, whatever that may be. It may have to be determined based on that those two health educators' research in the area to come up with strategies to get information out to the public. So it's, right now it's presentations, it's something online, a reporting process. It'll be the development of many printed materials that will be easily understood by the public. But activities, they will more than likely come up with far more than we're thinking of here at this point in time, because again, that's something that health educators have a great deal of expertise with.
Thank you.
Is there any further discussion on this communication? All in favor signify by saying aye.
Aye.
Opposed? The ayes carry the receive and file communication. Is there any further business to come before the Healthy Communities and Environment Committee? If not, without objection, I declare this meeting adjourned.